Good morning, friends. Today I want to discuss about liver analysis. That after examining the liver analysis of the patient, what disease we can find. So first of all, I want to give you a basic idea about the common bilirubin level. That's normal value is 8.5 to 20.5 millimole per liter. What is the benefit of this value? If the level of this value is increased, then we can say about different kind of jaundice, that from which kind of jaundice the patient is suffering from, whether it is suffering from hemolytic jaundice, parenchymatous jaundice, or obstructive jaundice. How we can reach to the conclusion whether patient is suffering from hemolytic jaundice, parenchymatous jaundice, or obstructive jaundice? We need to see the level of the common bilirubin. If the level of the common bilirubin is increased more than 20.5, and mainly we have two types of bilirubin, bound and unbound bilirubin, and another words we say for them, what we say, bound, unbound, or direct or indirect bilirubin. So if we see on the analysis, increase amount of indirect bilirubin, pay your attention. If indirect bilirubin is increased and presence of stercobilin in feces, then we can say it is hemolytic jaundice, means there is no obstruction at all. If we see the amount of common bilirubin is increased, the amount of common bilirubin is increased on the cases, in all the cases, then we can say about parenchymatous jaundice. Now the question is that here also the amount of common bilirubin increase, here also amount of common bilirubin increase, here also presence of stercobilin, here also presence of stercobilin. Then how will differentiate whether it is hemolytic or parenchymatous? Because I already said you, in case of hemolytic jaundice, only the level of indirect bilirubin will be increased. The level of common bilirubin will be equal to the norm or slightly increased. But in case of parenchymatous jaundice, the level of the unbound bilirubin or bound bilirubin, or we can say direct bilirubin or indirect bilirubin, almost same, and presence of stercobilin differentiate it from obstructive jaundice. So we can say our conclusion is parenchymatous jaundice. But if on the analysis we see that there is no presence of stercobilin, then we can directly say it's the case of obstructive jaundice, because there is some obstruction. The stercobilin does not come. So we read all the types of the jaundice: hemolytic jaundice, parenchymatous jaundice, and obstructive jaundice. And by seeing the analysis, we can easily differentiate which kind of jaundice the patient is suffering from. Then the next question is on the analysis is dysproteinemia. When we can say the patient is suffering from dysproteinemia, generally the level of the albumin is more as compared to the globulin, but sometimes there are some metabolic reactive changes inside the body, and as a result the level of the globulin is more than albumin, and this is the condition for dysproteinemia. Like if the level of the globulin become 55, 55, and the level of the albumin become 36, means in this case the level of globulin is more as compared to the albumin. So this condition is dysproteinemia. Now how we can differentiate the inflammation is chronic or acute? So to differentiate is the inflammation is acute or chronic, we need to see only four major factors. Actually, we need to see four major protein: alpha 1, alpha 2, and beta and gamma. So if you see that level of alpha 1 protein and alpha 2 protein is increased, so we can say the inflammation is acute. The normal values I given here, if the alpha 1 is between 2 to 5% and alpha 2 between 7 to 30%, then it is normal value. Remember, when we can say acute inflammation, when both value are increased. Suppose if alpha 1 is 8% and alpha 2 is 13%, then we cannot say about acute inflammation, because for acute inflammation both protein must be increased, alpha 1 with alpha 2. But for chronic inflammation, beta and gamma must be increased. The normal value for beta is 8 to 14% and for gamma is 12 to 18%. Here, I also want to remind you, here also will be the same condition. Like both values must be increased. Like if gamma becomes 20, if gamma becomes 20 and beta remains 9, then we cannot say about chronic inflammation, because for chronic inflammation both beta and gamma proteins must be increased. So if on the analysis you see the level of alpha 1 and alpha 2 both are increased, then we can say about acute inflammation. And if on analysis you find that level of beta and gamma is increased, then you can say about chronic inflammation. Now, I want to talk about additional test. On analysis, you will be able to see about sublimate test information. If the normal level exceed 1.8 to 2.2 ml, then we cannot distinguish any pathology, because to indicate the inflammation, the value of the sublimate test instead of increase decreases. And for thymol test, the level if more than 5, if more than 5, then we can say about inflammation. I also want to remind you that on the basis of sublimate test and thymol test, we cannot say it is inflammation acute or chronic. To differentiate is the inflammation is acute or chronic, I already remind you that to differentiate this, we have Weltman test, and already I told you of the condition of the proteins alpha 1 and alpha 2 for acute inflammation and beta and gamma for chronic inflammation. If on analysis you see the result, like there will be result like Weltman test 5 test tube. So you see it is the value between 4 and 7. So if the value between 4 and 7 means Feldman test is positive, it is not indicating any kind of inflammation. It is not showing any sign of inflammation. But if you see on analysis that Feldman test tube result is 3, it is the value between 1 and 4. So we can say this is the indication of acute inflammation. The same condition, if you see on test tube that Boltzmann test 11 test tube, then we can say it is the condition for chronic inflammation. So, on the basis of the Boltzmann test, if you see on the analysis test tube between 1 to 4, like I gave you example 3, then we can talking about acute inflammation. If we see the test tube between 4 to 7, then we are talking about normal condition, means no signs of inflammation. And if we see the condition between the 8 and 12 test tube, then it is the condition of chronic inflammation. Now, on the basis of the fat metabolism, how we can differentiate pathologies? So we have two syndromes. One is liver insufficiency, or we can say hepatic insufficiency, and another is the syndrome of cholestasis. So if the level of the cholesterol, lipid and phospholipid is decreased, so we are talking about hepatic insufficiency. But remember, if the level of the cholesterol is decreased but the level of the lipid and phospholipid remains same, so we cannot say about hepatic insufficiency. So to determine any pathology, at least two factor must be increased or two factor must be decreased, because for decrease we are talking about hepatic insufficiency. But if any of the two factor or three factor will increase, then we are talking regarding the condition of cholestasis. So I talk about the how we can differentiate acute inflammation or chronic inflammation on the basis of the alpha 1 protein, alpha 2 protein, beta protein and gamma protein. We talk about the fat metabolism, how we can differentiate hepatic insufficiency and cholestasis. We also talk about the Waldman test result, and how we can differentiate it is chronic inflammation, it is acute inflammation, or it is the normal value. So now the last is on the basis of the AST, ALT, and ALP. The main question is about the ALP. If you see the level of the ALP, alkaline phosphatase, is increased more than 1.3, even if it is 1.31, 1.31, then we are talking about the syndrome of cholestasis. And I also remind you, if the level of the cholesterol, lipids, and phospholipid is increased, then we can also say it is the syndrome of cholestasis. So to find the cholestasis syndrome, we have two criteria. If we see the direct increase in the level of ALP, then we are directly talking about syndrome of cholestasis. If we see the level of the phospholipid, the level of the lipids, and the lipid of cholesterols is increased, so we are talking about syndrome of cholestasis. So that's all information that I want to discuss. So on behalf of the values, now we will discuss about that which disease is here. So as we can see here that the normal level of the common bilirubin is 8.5 to 20.5, but here it is 60. So the level of the common bilirubin is increased. And we compare the direct bilirubin is 12, but unbound bilirubin is 48. So we can see highly or elevated unbound bilirubin. So now we will also check for presence of stercobilin. We see the presence of stercobilin, and if stercobilin is present and high marked unbound bilirubin, then we can say about hemolytic jaundice, because as we can see other all values are normal. You see Voltman test 6 test tube, and I told you if Voltman test tube is 4 to 7 test tube, then it is the normal. We are not talking about any inflammation. Sublimate test is 1.8, that is also normal. We cannot say about any inflammation. Thymol test is increased, and I told you it is all slightly increased, not so much. So we cannot say about any inflammation. The level of the alpha 1, alpha 2, beta, and gamma are also in their normal state. So we cannot say about any acute or chronic inflammation. So here we can see the level of the common bilirubin is increased, but here is mainly elevation of unbound bilirubin. An elevation of unbound bilirubin with the presence of stercobilin is the hemolytic jaundice. So this is the way how you must approach the analysis, how you must answer the analysis. So that's all for today. Thank you very much.